Okay, so Kerienne is presenting live on Thursday. And so I'm going to mute myself and give her control of her presentation. Thanks, Kerienne. Go ahead.
Good afternoon, everyone. Today I will be presenting on Ebola in West Africa, focusing on regions of Guinea, Sierra Leone, and Liberia. First off, I will be talking about the West Africa demographics. Firstly, the Western Africa Ebola virus epidemic 2014-2016 was the most widespread outbreak of the Ebola virus in history. Many lost their lives, which led to socio-economic disruption in the region, regions such as Liberia, Sierra Leone, and Guinea. These regions are considered some of the poorest regions in the world. They are underdeveloped, they suffer with sanitation problems, poor infrastructures, and they live severely below the poverty line. Guinea has a population of 13,072,779 as of today, with a 2.8% growth rate. There are 24 known ethnic groups in Guinea, with one of the lowest literacy rates in the world. Less than 30% of adults were illiterate in 2013. Sierra Leone has a population of 7,947,764 as of today, with 18 ethnic groups, 41% of adult literacy rate, a life expectancy of 55.92 years, and an infant mortality rate of 70.1%. Liberia has a population of 5,037,159 as of today, and a growth rate of 2.4%, and has 16 ethnic groups. These are some population crime rate of Guinea, Liberia, and Sierra Leone for male and female. I got them off of the website populationpyramid.net. I got updated versions of Sierra Leone and Guinea for the 2020 population. However, I got the 2017 for Liberia. So as you can see, this pyramid describes their population according from male to female during those periods. What is the Ebola virus disease? Ebola virus disease is an infectious disease which occasionally outbreaks primarily in Africa, the African continent. Ebola most commonly affects people and non-human primates, such as monkeys, gorillas, and chimpanzees. It is caused by an infection with a group of viruses within the genus Ebola virus. Etiology of Ebola and how it is transmitted. Ebola only exists in bodily fluids, such as saliva, mucus, vomit, feces, and dead body of an infected person. In order to spread Ebola, these must be transmitted from an infectious person into another body through the passageways such as eyes, mouth, nose, or broken skin. Many people, like in Africa, they have a religious way that they have to touch the body of a dead person. So when persons do that tradition, many people, that's how they can contact and did contact Ebola. Scientists believe fruit bats to be the Ebola natural carriers, but just to how it is transmitted to human, it is unknown. Common health issues prevalent in West Africa. In 2014-2016, Ebola outbreak in West Africa began in a rural setting of southeastern Guinea. It spread to the urban areas across borders within weeks and became a global epidemic. A total of 28,616 Ebola cases have been reported in Guinea, Libya, and Sierra Leone, with 11,310 deaths. To date, there are over 10,000 survivors of Ebola virus disease. This is a map I inserted of the Ebola virus disease epidemic in West Africa. This was taken in November 2014. This is when it first really got out of hand, out of control, before they started mitigating it. And you can see Guinea had cases of 2,164, and the deaths was 1,327. However, the deaths and cases have increased since this map. I have also inserted a YouTube video, which I would play now, which gives you a little more information about the outbreak of Ebola in West Africa. Let's hope it's playing. Keep in mind this. I'm sorry. I'm sorry, how do I get the YouTube video to play?
Can you either double click it or right click it and choose play?
Okay, thank you. I still have the slowest internet. I'm so sorry. Unprecedented Ebola outbreak in West Africa video. Okay, now I will be showing a video on an unprecedented Ebola outbreak in West Africa. Do enjoy.
An outbreak of Ebola in West Africa is now being called an unprecedented epidemic. Cases have been identified in Guinea's capital city and now beyond its borders, too. At least 80 people have died. Ebola is considered one of the world's most deadly diseases. And as Stuart Greer reports, aid organizations are working hard to contain it.
Preparing to do battle with one of the deadliest viruses on the planet, medical teams in the West African nation of Guinea cover themselves head to toe in protective gear in the desperate battle to contain the fatal outbreak. There have been isolated cases of Ebola in Africa before, but never anything on this scale. This is an unprecedented epidemic, says Michel van Erp from Doctors Without Borders. We're facing the most aggressive strain that kills 9 out of 10 patients. Discovered in Zaire in 1976, the Ebola virus can cause gruesome internal and external hemorrhaging. The victims slowly bleed to death. There is no vaccine, no cure. All doctors can do is keep a patient comfortable and isolated so others aren't infected.
There's really very little that modern medicine can do for this. Your white blood cells start attacking you instead of attacking the virus, and this is essentially what causes your organs to fail.
The outbreak began in January in a remote southeast region of Guinea called Nazaré. It's now spread to neighboring Liberia, with suspected cases in Sierra Leone. But most worrisome is the number of new infections in Guinea's coastal capital, Conakry. Fear has gripped the densely packed city of 2 million. Unsure what to do, people are buying bleach to disinfect their homes.
I'm panicked. I'm very confused.
And large public gatherings like concerts and sporting events have been canceled.
And setting one of these very, at least mildly contagious viruses loose in that kind of population center really has the risk of a humanitarian disaster.
With an international airport and Atlantic Harbor in the capital, health officials are screening travelers in the scramble to keep the deadly virus from spreading even further beyond Guinea's borders. Stuart Greer, Global News, London.
Was pushing false narratives and uncorroborated evidence. We investigated and shed light on some of the deepest government corruption in this nation, something that makes Watergate look like nothing in comparison. And take a look at this.
Okay, great. Effects of Ebola in West Africa. Locally. One of the explanations for the extent of the outbreak was the lack of response of local health systems. However, Africa, as I said before, West Africa is considered one of the world's poorest countries. So they did not have an adequate, healthy health system to combat Ebola. They lack resources, they lack supplies, they lack information and financing. So they did not have, locally, they did not have what it takes to combat Ebola. So the devastating effect of Ebola outbreak stretched far beyond the number of Ebola cases. And it resulted in the deteriorating of the health system. Many of their health workers died trying to take care of patients, and this led to the closure of many health facilities in Sierra Leone, Liberia, and Guinea. Global effect on the Ebola virus in West Africa. So there was an early international aid provided by the World Health Organization, the Médecins Sans Frontières, MSF, and the CDC. Initially appeared to help curtail the outbreak in March and April of 2014. Before this epidemic, CDC presence in all the countries were very limited. Teams work with host countries, governments, and partners as a key advisor on overall response management, including support for establishing EOCs by using an incident management system. External partners working with the IMS and with each other included CDC, WHO, MSF, USAID, and the United Nations agencies. In all three countries, the general response and emphasis, active surveillance, rapid case investigation, referral of patients with suspected Ebola for treatment in EPU, contact ascertainment and follow-up, infection control, and safe burials. So the CDC, WHO, and all these other organizations, they intervene in West Africa to try combat the disease. By doing this, they manage and surveillance the rapid growth of the disease, which helped them treat patients that were suffering with Ebola. The future of West Africa and Ebola. However, before, I know the video said that there was no known vaccine for Ebola. However, later on, during the epidemic, there was a vaccine created by the name of Ervivo. This vaccine is a single-dose vaccine regimen that can be found to be safe and protective against only the severe Ebola virus. However, I think there are 5 Ebola virus strands, but during that epidemic, they were affected with the zero. Ebola was determined to be 100% effective in preventing Ebola cases with symptoms onset greater than 10 days after vaccination. Ebola was accessed in 477 individuals in Liberia and approximately 500 individuals in Sierra Leone. Treatments also administered in the form of providing fluids and electrolytes through infusion into the vein, oxygen therapy, medication, support blood pressure to reduce the vomiting and diarrhea, and to manage fever and pain. So those were a few treatments that were administered during the whole Ebola treatment outbreak. West Africa after Ebola. Because of Ebola and its human economic toll, countries like Sierra Leone are now changing how they approach disease surveillance and control. As I mentioned before, these countries, they didn't have anything in, no protocol put in place before Ebola. When Ebola first existed, many people believe that it was a myth, there was no Ebola. Many people feel that governors were lying, they was just trying to get money. However, after they realized people were dying, they started to believe that Ebola did exist. And presently in Africa, they are district surveillance officers providing weekly and monthly reports on 47 diseases in the communities, immediately reporting diseases like Ebola, laser fever, cholera, and measles. Countries have focused on training health workers and surveillance officers. They have also improved their labs, their capacity to test specimens and collecting better data so they can analyze and address disease trends. However, when Ebola was first, when people realized that, I think it was our 18-month-old baby who died later on, his sister and mother died as well. And that's when they first tested, and they had to go to United Kingdom to get tests. So now they are creating labs in West Africa that can test instead of having to send away these specimens. The World Bank Group is working with 9 countries in West Africa, including the 3 I'm focusing on, to improve surveillance and early reporting. They're strengthening the laboratory capacity, workforce training, deployment and retention, and enhanced preparedness and rapid response. These are my references, and you can go on WHO or CDC if you want more information regarding Ebola epidemic in West Africa during 2014 and 2016. I thank you and have a wonderful day.